Hello, lovely. Are you comfortable? You in a little bit of pain? Whereabouts? Where you bang your head. Okay. What happened? Oh no. Yeah. Okay. Well, not to worry. I'm here to check you over. Alright, to make sure everything's okay. Alright. So, can you just tell me your name? Okay. And your date of birth. Thank you. So, do you know what time it happened? Okay. What were you doing? Okay. So how did you hit your head? Okay. Did you black out at all? Just for a split second, okay. So any nausea or vomiting? That's good. What about any dizziness? Okay, a little bit. What about when you move your head? Okay, if you just try to move your head for me. Are you alright? Any dizziness? Okay, that's good. Any ringing in your ears? Okay. Any double or blurred vision? So no double or blurred vision. What about any sensitivity to the lights? Okay, and what about sounds? And any memory loss at all? Okay, so you are answering my questions very well, which is good, and you are responding brilliantly, so that's a good sign. Alright, so whereabouts did you hit your head? Okay, alright, does it sort of touch? And was there a lot of blood or? Okay, so not too much, but there was a little. Okay, that's fine, so a little bit. Okay. Now, has anyone done anything to clean it up? So just put that pad on. Alright. And they held some pressure as well. Okay, that's good. I'm glad to hear that. Alright. So, my love, I've got some vital checks I need to do. Okay. Whilst we are talking, I may as well do this little part first. Okay. So, what's your name? I know this might seem repetitive, but it's essential. Okay. Your date of birth. Okay. Where are we? And what's the date? And where did the incident happen? Lovely. Okay. Now, I'm going to say 3 words and I want you to repeat them. Okay? Moon, picture, leaf. Okay. And again, moon, picture, leaf. Well done. Okay, so can you count backwards from 10? Good job. And can you count 1 to 10? Good job. Can you spell hello? And can you spell it backwards? And what were those 3 words I told you earlier? Excellent. And finally, can you just tell me what happened? And where did you bang your head? Thank you. All good. Perfect. So, I'm happy with everything so far. Alright, you feeling okay? Good. Now, anytime if you feel dizzy, unwell, sick, or anything like that, please just let me know and we can take a breather. I want you to just sit as you would. Okay, good. Now, if you can just look straight at me. That's it. Just that. Okay, so I want you to look at my nose. And then I want you to look here, just with your eyes, okay? Good. Nose. Finger. Nose. Finger. Good. Nose. Finger. Nose. Finger. Nose. Finger. Excellent. Now, keep my finger here, alright? Just with your eyes, I'd like you to look at my eyes, nose, finger, good, nose, finger, eyes, okay. Nose, eyes, finger, eyes, nose. Perfect. Excellent. How many of you can you see? Good. Good. Okay. Now, I want you to close your eyes. How do you feel? Do you feel dizzy or do you feel okay? Okay, that's good. Now, open your eyes. You still feel okay? Good. And close your eyes for me. Are you feeling okay? And open. How are you feeling? Good. I'm glad to hear it. Now, with your eyes closed, I want you to turn your head to your left. Good. How are you feeling? Okay. Keep your eyes closed and turn your head to your right. How are you feeling? Good. Now I want you to pop your head back to the centre. Are you still feeling okay? Good. Now I want you to take your head right down to your chest. Okay. Keep your eyes closed to me. How are you feeling? Good. And I want you to go all the way back now. Back as far as you can, but steady. How do you feel? Okay. And come back. And open your eyes. How are you doing? Good, I'm glad to hear it. A little bit of dizziness, but nothing too excessive, okay. Small amount of dizziness. What move in particular made you feel a bit dizzy? Down on the way back. Okay. Now, any spinning or any weird sensations? Just that slight bit of dizziness. Okay, but you feel okay now. Good. What were those 3 words I told you earlier? Well done. Okay. So far, so good. Okay. Now, just take a look at this eye chart. Now tell me, do the letters appear blurry or wishy-washy? Good. Can you tell me what colour that is? And that. And what about my nails? Well done. And what about my top? Good. Now back to the letters. I want you to start from the top and read as far as you can for me, okay? When you're ready. Okay. Do you wear glasses normally? Alright. Now if you can cover that eye for me and read as far as you can. Okay, and cover that eye. And same again. Okay. Now, did you find it easier with both eyes clear? Good. And which side covered was more difficult? I thought so. Alright, I mean, I'm not an optician, but definitely something not quite right there. When did you last go to the opticians? Okay, maybe worth having a check, my love, okay. It might not be linked, you see, and they will do a full exam. So eye exam needed. It was all right when you were reading. Did you feel any nausea or anything like that? Any dizziness? No, you felt fine. Okay, good. Excellent. So, okay. Now, I need to look at my nose. Keep looking at my nose, okay? Just my nose. Keep looking at my nose. Just my nose. Excellent. Keep looking at my nose. Okay. Keep looking at my nose. Good. Keep looking at my nose. Okay, wonderful. Let you focus a little bit. Okay. Now, to keep looking at my nose, alright. And I want you to tell me which side you see move on my fingers, okay? Good. And again. And one more time. Excellent. Did you find that quite easy? Good. I want to keep looking at my nose, okay? Tell me when you can't see my fingers anymore, but you must stay looking at me. And again. And one more time. Okay, now tell me when you can see them again. Good. And one more time. Excellent. Well done. Keep looking here. Tell me how many fingers you see. Good. Keep looking at my nose. Keep looking at my nose. That's it. Okay, when I went a little bit faster, did you find it a little bit more difficult? Okay, any blurred vision or dizziness or anything like that? Good. Okay, and now I want you to follow my finger, but just with your eyes, okay? So keep looking here. That's it. Keep focused. Perfect, well done. How did that make you feel? Good. I'm going to use this, I think. So, I have this tape measure, okay? I'm going to point to a number and I would like you to tell me what the number is, okay? Okay, so if you look at this, okay, I want you to tell me what number that one is. A little bit blurry. What about that number? Is it still blurry? Okay, let's try the other side. Okay, how about that? Okay, if I move it away a little bit. Okay. And how about that one? Okay. Maybe a little bit tricky. Okay, if you look at this. Okay, now it's got numbers on it, okay? I would tell me what number that is right there. And what about that one? And that one. Lovely. What does this one? And that one. Okay. Okay. Is that more blurry? Tell me when it goes clearer. Okay, so blurry, clearer. Okay. Perfect. Not too bad, my lovely. Okay. Now I'm going to do a few fast movements. Okay. Now, my finger, I want you to follow it. Okay, we'll be quite quick. Okay, how did that make you feel? A little bit dizzy. Okay. What about now? Follow it around in circles. And again. Okay, what about this? Okay, so fast movements are a little bit on the dizzy side. Are you feeling okay? Do you need a drink of water? Are you sure? Okay. You're not so dizzy now. Okay. Alright. So. Okay, my lovely. I'm gonna have a look in your eyes now. Now this light will be bright, okay? And it may make you feel a bit nauseous, it may not do. It may make you feel a bit dizzy, and it might not do. Okay. You can see the light, it's quite bright. Okay. Now the movements won't be fast, so don't worry about that. But just to check, are you epileptic? Okay, good. Look at my nose. Okay, I'm slowly going to bring in the light, okay? That's it. And back. Good. Now we have to keep looking at my nose, okay? looking at my nose. How do you feel? Your pupils aren't reacting as they should. Yeah, they're not dilating correctly. Alright, which is a little bit concerning, but, you know, could indicate a concussion. And mixed with a little bit of dizziness. Yeah. Okay, and you've got a headache as well as pain around the cud. Okay. Right, and now I'm going to just have a look at the whites of your eyes, okay? So just keep looking straight. At any time, if it gets too much, please let me know. Maybe a little bit bloodshot. Okay. Now, just with your eyes, would you mind just looking up? Thank you. Just want to check the whites here. Okay. And back. Okay. Look that way, just with your eyes. Thank you. Okay, and back. Now that way. Okay. Back. A little bit bloodshot. Do your eyes appear bloodshot normally? Okay, so not usually. Okay. And how did you feel when I was doing that? A little bit hot and flustered, okay. Would you like a drink? Please help yourself, okay? It's there for you. Alright. Just gentle sips, my love, don't guzzle. Okay. Okay, so that's that. Do you remember the words I told you earlier? Okay, good, well done. Okay. I just want to try something. Okay. Right, I want you to look at these two lights. Okay. Do they look the same? Okay. And what about now? Do they look the same? Okay. So which one would you say is the warm light and the cold light? So you've got the warm light, the cool light. Okay. Now which is easier for you to look at? Is it the warm light or the cool light? Okay, so you can tell they are different. Okay, is it quite a lot different or just slightly? Okay, good. Right, just tell me any pain or pressure or ringing or popping in your ears at the moment. So nothing's triggered since doing any of this. Okay, good. I'm glad to hear it. Now, just check that. Okay. Right. Please look at my nose. Feeling okay? Good. How did that make you feel? Okay, so a little bit dizzy. Okay. Now, can you blink for me? Okay. And again. Now 3 times. Blink, blink, blink. Good. And another 3. Blink, blink, blink. Okay. Now I don't know whether you normally can wink, but can I get you to try on either side? Okay, good try. Can you not do that normally? Okay, that's fine then. Okay, now you've been having bright lights in your eyes. Do you have a worse headache? You do. Okay, so it's escalated your pain. And whereabouts is the pain? Okay. What type of pain is it, my love? Yeah, so try and separate it from the bump. Just describe the headache. Okay. Okay, is it similar to a normal headache you've had, or is it any different? Okay. And are you feeling comfortable, or are you uncomfortable at the moment? So. Okay. You're doing really well, my lovely, okay? Right, I can just check your pulse now, okay? If I can have your index finger, pop it in there and just relax, okay? So, pulse and oxygen. Right, let's have a look. Oxygen is fantastic. Pulse is on the high side, my lovely, okay? I will check that in a little while. Right, if I can check your temperature. Okay, I'll put this there. Okay, and I'm going to pop it in your ear. Alright, just going to pop that in. Okay, I'm just going to check the other side, my lovely. Pop it in. Okay, that's fine. It's in the normal range, but a little bit lower than normal. Do you know what your temperature is usually? Okay, so it's definitely a little bit lower. It can fluctuate, my lovely. Some people's temperature is naturally a lot lower, and and that's okay. And it still is in the normal range, just on the lower end. But as you said, that's not normally yours. It's a little bit, got to keep an eye on that. Okay, so I will need to check your blood pressure, my love. Okay. So I could have this on. Okay, so we're going to put that all the way there like this, okay? And we place that just there. And swing it nice. Comfy? Good. Now I just want you to relax, keep your feet nice and flat on the floor, and try not to move or talk, okay? And trust me, it will go very tight. Okay, I'm just going to check it again, my love. Remove that. Now your blood pressure is slightly high. Do you normally have high blood pressure? You don't. Okay. Okay. Okay, I'm going to check your pulse a little bit later. I want to leave a little bit of a gap, okay? Right, so I'm going to pop on some gloves. You're right. As good as you can be. Right, okay. So, what I'm going to do is just have a feel around your neck first, okay? Am I alright to touch? Just tell me if you feel any pain, okay? Okay. Do you normally have any neck or back pains or problems? Okay. Okay. Now, carefully, can you rotate your head in a circle? Okay, right. Okay, and the other way. Okay. How are you feeling? All right? Dizzy? A bit hot, okay. Okay, have a drink, have a drink. You want me to get you a drink? Are you alright? You can manage a drink, are you sure? Okay, so we've got dizziness, and hot. Okay, spine feels okay, his neck feels okay as well, maybe a little bit tender. Okay, now, are you alright for me to continue? Okay, I'm going to have to feel around your head and have a little look. Now, by the dressing, I'm guessing you've already seen a nurse and they've dressed it, etc. Okay, and they're happy with the cut. Okay, I'm not going to do much with it, but I will have to go over it, okay, just to see if there's any new lumps and things. Okay. I'm just feeling for any swelling, any more lumps. Okay. Yeah, it's quite a swollen lump. There's no bleeding coming through, which is really good, okay. But you've definitely got a lot of swelling around that. I don't really want to open it up just yet. Okay. Okay. All right, my love. So, I carried out my checks, and I would say you do have a mild concussion. Okay, not too extreme, which is good, but it definitely is something there. Yes, that's correct. So I would like you to stay in, unfortunately. Okay, but you're in safe hands. The night nurses here are wonderful. Okay, so mild concussion. You know, you're experiencing like dizziness, you know, headache, quite a lot of pain. The lump on your head is very, very swollen. All right. Yeah, and then, you know, you just aren't appearing very good, if that makes sense. But I must say, you've done really, really well. So that's why I would say it's only a mild concussion. It's definitely a little bit of blurriness with the letters. You know, so, and that with your high blood pressure and high pulse. Yeah, if you can just pop your finger in here, actually. Okay, and just rest there for me, okay? Let's check that again. Okay, thank you. Yeah, so your pulse is still high. So mild concussion. Overnight stay needed. Okay, because we need to monitor your blood pressure. We need to, you know, keep an eye on your temperature to see how it fluctuates, and obviously keep an eye on your pulse. With the lump on your head, we need to make sure it doesn't get any bigger. Yeah, and it doesn't cause any other symptoms. Yeah, some things can happen a little bit later, so, you know, we really need to monitor you, especially because that is a very large lump, and I'm not sure they said it was that big, but I think it's quite large, so I would like to keep an eye on that. And with obviously the high blood pressure and the pulse and things, it's, you know, definitely need to be kept in, unfortunately. But some of the tests you did really well, okay? So there'll probably, some of them will need to be carried out again a little bit later. But like your pupils, you know, aren't reacting as they should. They are looking a little bloodshot. So all these little things are, you know, adding up, which is, it's not too good. All right. No, my lovely, you're going to be perfectly fine. All right, this is just a precaution, and I want to make sure that you are fine and well before you go home. Yeah, okay. Right, so just going to send a message to the ward. Just wait for them to get back to me. So what's going to happen now is you're going to stay here for me. Just have some sips of water and just try to relax, okay? Then somebody will come over and take you to the ward where they'll set you in and do the usual obs and just make sure you're okay and comfortable. Don't worry, it's absolutely lovely over there. And then, you know, that you're going to stay there and be monitored through the night by one of the night nurses. All right, and I take good care of you, and then you'll probably have some other little checks along the way, and in the morning one of the doctors will come round and, you know, carry out some checks like I've done and make sure everything's okay. All right, and then once everybody is happy, you can go home, but we do need to keep an eye on these obs and different things like that just to make sure everything is fine. Okay, oh, hang on a moment. Yes, there is space now, actually. Okay, good. So, that is all done. What I'm going to do now is leave you to just chill, and I'm going to go out to do a little bit of paperwork and stuff, and then somebody will come. I should be here any 5-10 minutes, and then they can take you over. Alright. It was lovely to meet you, and I'm so sorry that you're not feeling too good. Alright, but please, at any stage, if you feel unwell or in pain or anything, please just tell one of the staff. Alright, and I will be recommending that you have some pain relief and anti-inflammatories. Alright, so this is all going to be in your notes, which is why I like to type it up, and then they'll get it down when you're on the ward. Okay, you're very welcome. Now, hope you get better soon. Alright, and take it easy. Alright, you're very welcome. You take care now. Bye-bye.